Hi, I'm Elizabeth Morrison, the Living Donor Social Worker at Mass General. I'm going to talk to you about the potential donor psychosocial risks. Psychosocial risks are anything that could be related to your life or well-being that are not directly associated with your medical needs. The following mental health risks are associated with living kidney donation, which may be temporary or permanent and include, but are not limited to, problems with body image, depression, and anxiety. It is also not uncommon to experience feelings of guilt, emotional distress, or grief if the recipient's transplant isn't successful, or if the recipient's body rejects the kidney disease returns, or if the recipient dies. You might also find that lifestyle changes may be required before or after surgery. If these changes are required before surgery, your team will be sure to let you know. There are also potential financial risks associated with living donation, which may be temporary or permanent. While we don't expect these concerns, it's important that your social worker explores them and discusses a plan with you. They include, but are not limited to, costs associated with travel, housing, accommodation, childcare, and lost wages. There are also potential risks around loss of employment or income, negative impact on the ability to obtain future employment, negative impact on the ability to obtain, maintain, or afford health insurance, disability insurance, and life insurance. The recipient's insurance could refuse to cover medical complications and future health problems after donation that are not covered under the recipient's insurance. Additionally, there's also the need for lifelong medical follow-up at the living donor's expense. For these reasons, we strongly encourage that all living donors obtain their own health insurance. Resources may be available to help with some of the costs I discussed here. The U.S. Public Health Service has identified a list of risk factors related to the donor that could impact the transplant recipient. A series of questions will be asked, and if a donor answers yes to one or more of these behaviors within the last 30 days, it does not mean that they are ruled out for donation. The recipient is told that the donor answered yes to at least one of the risk factors, but the recipient is not disclosed which of these behaviors the donor answered yes to.